well as some planning. Um, our learning exchanges are being developed as with many things. So I'm not going to use any of those catchy adages about planes and automobiles and trains and stuff, but we are definitely building it. And what we realized is that the community voice is super important with regards to the development of this team and what our outputs are. So one thing I want to highlight is that we like repeat attenders, not repeat offenders, because those are the people who don't come back. We want repeat attenders, right? So if it's not an interest of yours to be committed to this as a cohort, we still want you. We still want you here whenever you can. But if you can, it's one of our major objectives that we're working towards is to have folks come back so that we can see what a build on work would look like. Now, the catch to that is, what do we do? Well, the one thing we have and the one caveat we have is that it has to be about prevention through a COVID-19 lens, right? We have some other learning exchanges that we may talk about in a moment. I'm going to highlight what those are if you have other interests. But for this particular learning exchange, we're going to talk mostly about COVID-19 through a prevention lens. So that's just the high level. And today, how we're going to do it is we're going to do some introductions, and I'll give you some instructions as well as I'll show you what we want in our introduction. Then we have a guest, Jasmine Brosnan from the Child Abuse Prevention Center of Sacramento, who I've done some work with around data before. So I felt like bringing her in and quickly showing us how to pull your own data with regards to COVID-19. And then how do we apply it to our prevention work? So we're going to learn how to pull data today. We're going to quickly learn how to look at a few things. What story is it telling? Are there any aha moments? Did I know this already? And the data just supports what I already knew. So those are the sorts of things I want you to think about with this data. And then ultimately, what can we use this group for? I got money for presenters. I got time and authority from OCAP to get some things done, and then some facilitation and facilitators that can help us through this. So now I'm going to eventually throw it back to the group and say, what do we do with it? Because we need this forum. We need to collaborate. We need to know what each other is already doing. So those are just some ideas to start bantering around, because the hope is that, and the goal is that this is a member-led, member-driven group with some outputs around COVID-19 prevention work. Simple goals, but they're like 10,000 things that just ran through your mind with regards to what we could do. We just got to focus it. So keep that in mind as we're going through. So introductions. Quickly, I said quickly, we got a bunch of folks in child welfare and social work. We don't do anything quickly, right? So give me your name, agency you're from. I'd like to know what you're doing already in this COVID environment with regards to your prevention work. I'd like to know simply maybe what your agency did. Are there any novel things that are going on? Are there any successes you're having? Because we're going to talk about the challenges later. So let's talk about what you're doing, your aha moments, or the things that have maybe helped or recognized or helped you with goal setting. How about I start to show you what I'm looking for? My name is Troy Nichols. I'm with Strategies TA. I am a technical assistance specialist. What we have done, the first thing that we did was we figured out how to work from home. I think in our prevention work, that was the very first thing that we did that helped us the most, is we figured out that we could still do it. I think the very next thing that would come to mind is our outreach to our counties, so what we do is we outreach to counties, and you guys are familiar with this. We outreach to counties and we are assisting them with their prevention work, developing their prevention teams, simply put, because it looks different across the board. So our outreach to our counties was, how do we support that? What can we do, being that we're going to stay open, which was a blessing in itself? what can we do with this time that you have of mine to assist you with developing your prevention work? And what came out of it is some prevention planning, some work planning that we're able to do. And that looks different across the board. So if the two things that I could bring up that I feel like really began to help me focus in this COVID-19 environment is the fact that we collaborated and figured out how to do this work remotely. And then we reached out to our partners to say, here's what we can do with regards to the prevention work and supporting you. And in many ways, just to give you some example, we've facilitated meetings, we've brought in speakers, we've helped folks develop their goal setting plans for their prevention work, working with both the counties and their CAPCs. So what we were able to do is in this environment, provide you with some level of stability around facilitation and goal setting. All right, who wants to go next?
I'd like to introduce myself to the group, Troy.
Thank
you. My name is Bryn Pascal, and I am also a strategies TA through the Child Abuse Prevention Center. And I wanted to introduce myself. If you have any technical difficulties, any technology needs, I'm the producer for today's meeting. So feel free to send me a chat, a private message, flag me down, and I am happy to help you with any of your needs. I also wanted to note, I know some of you have been on, you may notice that we have ASL interpreters today and closed captioning, and we are really grateful to have those options for those of you who may be hard of hearing or deaf, and just to have them for the recording for anyone who maybe missed this meeting. So if you'll notice that the interpreters are spotlighted, but if you are having any difficulty with that or have any questions about why we chose to have ASL interpretation, again, you can send me a chat about that as well. So as for Troy's introduction question about what we're doing in times of COVID, you know, I work in the same organization as Troy, so my answers would be very similar. But I just think it's great that we've been able to adapt to the times, and we would likely be having these meetings in person if we weren't in the middle of a pandemic, which of course would be wonderful to see all of your smiling faces in person. However, you know, offering this virtual option does allow us to have people from all over the state join us and increase some of the accessibility. So I think it is an impressive thing that we've managed to accomplish, and I hope you find today's meeting helpful.
Thank you, Bryn. So how should we do this? Should we offer you guys to pick yourselves, or do we tag people? How you feeling? Or I can pick them.
You can pick them.
Right.
You can pick them. I can pick them. You can tag people. We can popcorn it, whatever you'd like.
See, this is why it's hard working with me and Bryn, because we're really flexible sometimes. All right. So, hey, Rosalind, why don't you go next?
Yeah, I can volunteer. So my name is Rosalind. I'm with Strategies TA. Prior to joining Strategies TA as a senior technical assistance consultant, I worked on the front line, so I have direct experience with public health and COVID. And so I'm really glad to be here. And I want to say thank you to everyone for sharing your time to be here today. And I'm really looking forward to supporting you and learning alongside you as well.
So I want to publicly acknowledge my horribleness with Rosalind. Rosalind is my partner at some level, but I'm the lead. I didn't pull Rosalind along in this particular planning of this because it was so all over the place. So here's what I'm going to offer to Rosalind, that this is the steps to organization. Rosalind is far more organized than I am. So I'm going to give you the opportunity to help me be more organized, because this group, we're going to pick our dates today. We're going to do a bunch of things. So Rosalind, I truly appreciate all that you've done. You stayed on top of me for this. Here we are today. And from here forward, it's going to look like you expected it to. I really, really appreciate it. I wanted to publicly acknowledge that, because at times behind the scenes, people don't know what's going on, and I left you hanging a couple times. Not going to happen again. We're all super busy, but this group is going to keep us in line, and I appreciate you much.
I want to say thank you to everyone for being here. Please feel free to share. Yeah, and thank you, Troy, for helping, Troy and Bryn for helping to put this together. And thank you so much to our ASL interpreters and our captioners as well, and our speaker. Thank you.
All right, so let's just stick with our team. I'll keep tagging you guys until we get us out of here. So Sarah, you can go next, and Jasmine, why don't you go after that?
Hi, everyone. Good afternoon. My name is Sarah Lockhart, and I help to support the Strategies TA team as well out of the Children's Bureau of Southern California side. So we're helping to support the Central Valley counties, Southern California counties. And yeah, I'm really interested in the topic and glad to be here today. And thank you all for coming on a Friday afternoon. Like, that is commitment for sure. In terms of COVID-19, so I should share, I'm also the director for the Los Angeles County Child Abuse Prevention Councils. And I can tell you that the council work in that regard shifted, they shifted incredibly fast. I mean, I was so impressed by that group's ability to say, okay, pivot, we can't do this in person, let's do it a different way. So many of the events, so a lot of their work is primary prevention. And so they're doing a lot of their advocacy and also their trainings. They just shifted online. And that's thankfully continued into this year. And as you all know, probably will impact how we work in the future when this pandemic is over. So I'm sorry, Troy, you said you had something else. I'm not tagging, right?
You can though, see how flexible we are?
I think I was
I did pick Jasmine though, but
okay.
If you'd like to tag Jasmine, that would be
Go
great.
for it, Jasmine.
Hi, thank you. So as Troy introduced me, I'm Jasmine Brosnan. I'm the Evaluation Senior Project Manager at the Child Abuse Prevention Center. And Troy and I have worked together on a lot of projects over a long period of time. So when he called me and asked me if I wanted to help with this, of course I said yes. I absolutely love data. It's a second language for me. I truly enjoy it. So I was happy to be asked to come and visit today. Even though I'm at the Child Abuse Prevention Center with Troy and Bryn, I think I have a little bit of a different perspective just because my projects are a little different. And so as much as, yes, I think, we transitioned into doing working from home. Some of my projects were, we had to learn a whole new way of communicating. And I think that that's something that has been hugely beneficial for a lot of people, at least on some of the teams that I'm on, because I handle a lot more of the confidential side of things, right? So I help run our child death review team, our fetal infant mortality review. I do a Department of Justice project across the states. And so there's a lot of stuff that we really had to consider and really think about. Not only with learning how to have those confidential conversations in a safe space, but also how to give people the time they needed to work on those other projects. I'm on a lot of teams with doctors and public health officials and people that just don't have time to come to these voluntary groups and participate in things. And so we've really had to learn how to slow down and take things at a different pace and approach them in different ways. So learning just new ways to collaborate, I think, is the big thing that came out of it. As far as planning goes, so I do have the privilege of helping on the Sacramento County prevention planning portion. So I have a lot of group insights on what that looks like. So Sacramento County was one of those first people at the table. So they've had a lot longer to work on this, which has been beneficial and definitely something to reflect on, but also we had started this work before COVID, before the pandemic kind of took an impact on us. And so we've gotten to see also the shift in what that looks like a little bit, right? So we started planning and then had to reevaluate everything based on where we were and determine what changed and what didn't change based on some of those new engagements and happenings and all of that. So yeah, I think I've learned a ton with COVID-19, and I think it's been hugely impactful across the board. but definitely something to reflect on. So I'm super happy that we have this group to have a conversation about prevention planning and what this is truly going to look like in the grand scheme of things. Troy, do you want me to pick someone? I'm just going to pick Marissa because I know Marissa. So, okay, go ahead, Marissa.
Thank you.
Hi there, I'm Marissa Provost. I am the Evaluation Project Specialist with the Child Abuse Prevention Center. I work very closely with Jasmine. And I feel like I have a somewhat interesting perspective on the adaptations to COVID, being as I started in July of 2020, when we were already in the full swing of working remotely. So I have only done this job remotely. I've only recently started doing some in-office work. And so I will take this opportunity to toot the horn of the CAP Center for having a very, very solid plan when I came on about how to train me from a remote location and give me the work that I needed to do and the answers that I needed to learn my job from home without being able to just pop over to the other office to ask a question. I've had to be a lot more accountable for my own work and a lot more resilient when I may not know an answer, which I think in the grand scheme of things will make me a much more well-rounded worker. And I think a lot of us may feel the same way, having to have transition to this new way of working over the past year. As far as planning goes, since I work very closely with Jasmine, she kind of covered everything that I would have to say about that as well. So thank you, everybody. Nice to meet you.
Thank you. I did not know I had 2 data people coming. That's like a blessing, right? Because how many people have trouble with data? Jasmine's the person that made me realize data was friendly, right? About 4 years ago, we did a project that she's going to speak to here about how you pull your own data and read it. Anytime you can teach a guy like me to pull data and read it, you're an expert. So let's pick our next person, but keep in mind, that's kind of where our focus is going to end up today, is us looking at some of the data to tell the story about how we can make this happen. Thank you, Jasmine and Marissa, for being here. So the next that I see on my screen, I see Adela. Welcome.
Hi, thank you. I'm not sure what I'm all getting myself into, but I am with the Woodlake Family Resource Center here in the Central Valley, Tulare County. Work really closely with Tulare County Child Abuse Prevention Council, and I just seen Amanda is on this Zoom meeting. So looking forward to seeing how we can maximize our services and gather the important data that we need to ensure sustainability as we move forward with supporting families and organizations as well.
Thank you, Adela. I really appreciate that, but knowing that there's somebody from a family resource center that works with somebody from a county and you're both here warmed my heart. We're gonna work to get more of that collaborative membership going on. Thank you so much. Amanda, since we've brought you up, can you go ahead and introduce yourself next?
Yes, I will. And if you can tell, I'm driving. I was wearing one of the many hats that a CAPC director wears. I was speaking to a group of potential funders. So send good vibes, okay? But yes, my name is Amanda. I'm the executive director for Tulare County's CAPC. And you know, I think one of the things that I'm really excited about sharing is that we have really been intentional in our work this past year. We had to realize that, you know, people were going to social media for information, and we just needed to find our place in that digital world. So we very, very quickly moved into providing trainings and presentations online for professionals. We modified our mandated reporter training so that it would include not just behavioral indicators of abuse, but physical, but behavioral ones also, because our 90% of our mandated reporters were not seeing children anymore. So, but they were engaged with them online. So we very, very quickly changed our delivery of our services to be online. We offer over a dozen different trainings to professionals, resource parents, community members, and we're very unique in that our CAPC has about 30 different organizations, from probation to law enforcement to community-based organizations. First 5 of Tulare County is part of our CAPC, CASA, and well, it's just been a phenomenal year of, again, just kind of redefining what prevention means, and meeting not just the primary, but the secondary and tertiary levels as well. Yeah. So I'm just really proud to be part of a county that works really, really well together to keep our children safe.
Thank you so much for that introduction. First, the dedication of introducing yourself while driving. I truly appreciate that. Now, I'm a coach by nature, so I coach sports. So I'm going to treat this like this. Everybody, the bar has just been raised around attendance, just so you know. She really raised the bar around when and how you can, or if you can attend. So thank you so much. But what's super important is listen to her talking about that collaboration. That's the piece that we have to start to pull out of our meetings now, because one of the main focus that I want to get from this is us sharing what we're already doing so that each can build from that. So that's a huge piece for me. Thank you, both of you, for being here. Adela, you said you're not sure what you're getting yourself into. I'm hoping that you're getting yourself into some collaborative work that helps make your day easier. That's my hope. So I don't want any more work. Anybody need more work? Raise your hand. Okay, exactly. So if you raised your hand, I was kicking you out of this meeting because you're in the wrong place. I don't need any, and neither do you. So that's going to be our focus. Thank you for those introductions. Who's next? Sarah, can we go next? That's because you have your camera on. You know you get spotlighted when you have your camera on.
Sure. Well, I actually work with Amanda with the Tulare County CAPC. So she did an awesome job. I would just also add, so I started in September, so I'm relatively new and, in the middle of the COVID and all, but one thing that I've really appreciated during the season is the amount of online trainings that we've been able to participate in, and just being able to take part in those and gathering the data, and just being able to participate has been helpful, I think, for me with prevention. And again, I love data, so just gathering and seeing the effects of what's happening. And so anyway, that's just an addition I would make.
All right, we officially have a t-shirt. I love prevention data. You're the third person that said I love data, and not sure how I got here, but 3 people that love data, we're making t-shirts. So I've really realized that this is how we're going to tell our story, right? Pull this data, qualitative, quantitative. How do we get people to understand where we are, where we've been, and how we want to, and where we want to go? And that's this data pull. So thank you, definitely. Next, can we have Sandra? I see Sandra on. If you are, I see you're on twice, so I get it. You're probably on a camera and a phone, and hey, technology understanding is always in my meetings.
This is Esther Franco. I'm the director, and I came in under Sandra's registration because I didn't think I was going to be here today.
Well, welcome, Esther. It's so good to see you, hear you. I'm glad it's Esther. And I mean, Sandra's fine, but I'm glad it's Esther. I have not talked to you in so long. Sorry. Go ahead and introduce yourself.
Okay, Esther Franco. I'm the director of the Fresno Council on Child Abuse Prevention, Fresno County CAPCs. Also the president of the Central California Coalition of CAPCs. What was the question? What did COVID do to us?
Hey, that sounds like a better question. But yes, you can go with that. But just what were some of the aha moments, some of the adjustments, maybe even some successes that we weren't quite sure where we were going to get, how we were going to get there, but that you got there with your prevention work around this time, around COVID-19?
Well, as soon as we went into sheltering, what was it, the second week of March, we knew that we were going to have a problem with domestic violence. So we contacted all our domestic violence prevention education partners and shelters and said, what do you need us to do? Then Sandra, who's just amazing, and my other part-time staff person, we had to reprint more. We have family resource posters that list, and they're categorized by all the causal factors for child maltreatment. It's information and referral, like for behavioral health, housing, substance abuse disorders. And so we went to all the food distribution. Well, they did, not me. I'm saying we. Sandra and Michelle went and distributed posters to all the food distribution centers. We went to WIC centers. We just kept promoting, we realized that the stress of COVID is going to intensify things that will lead to possible child maltreatment. So we've done, PSAs. As far as our primary prevention, it totally disrupted everything because we had a plan to bring under the Innovative Partnership Grant to bring out Dr. Ira Chasnoff on substance use disorders, prenatal, because Fresno is the meth capital of the world. We have all these, #1 in syphilis, #1 in meth. We have all these horrible titles, #1 in poverty, 38.9%. And these are all causal factors, that were related to child maltreatment, as you all know. So we brought Chasnoff off and working with public health, and we had to cancel our conference and just reschedule. And then, we were working with OCAP and strategies. And since that time, we know child maltreatment has increased. There's been 2 headline cases. One was a 8-year-old boy was beaten to death. The mom left him with the aunt and uncle because she had substance abuse problems. And another 4 children were found by themselves in an apartment. Mom was out playing poker, dad went to work, and they said there was no food, extreme filth, poverty. So we're dealing with a lot. We're trying to get, the keeping your family strong, the protective factors from the prevention resource guide. We've updated our website. We're doing PSAs, contacting the Fresno Bee, our local paper. That's about it in a nutshell for now.
Did you really just end with "that's about it"? Like, I don't want to hear that one again, because woof, right, guys? I mean, a lot of stuff going on there, but I can't be any happier about our introductions already. We're doing the work, I feel. Someone is already interested in something that someone else already said. And no one seems like they're a quiet type on the call so far. So I appreciate that even more, because I want us to share with each other what we're doing so that we don't have to make the same mistakes twice. So that's my goal.
Thank you, Troy. I really needed to hear that, because I was just crying on Sandra's shoulder this morning, that it's like, God, it just feels like it's not enough. I mean, I don't know what else to do.
Listen, I don't do a whole lot of things super great. Like, ask Rosalind, I don't return emails well at all. But I am a super coach and encourager. And if this group needs to be encouraged, then that's what I'm going to do. Esther, I done seen you do a lot of work for a long time, so I did not expect anything different. So if you're crying on someone's shoulder, you need to call me more often.
Okay.
All right.
I
and
will.
This group will be what this is for. We're building this right now. We are building the comeback, meaning we have not had success in people meeting over a period of time consistently. It just hasn't worked, and it's not anyone's fault. But my plan is for us to build this. And Esther, you just told us we also needed to tell each other we're kind of great sometimes.
Mm-hmm.
That's a COVID-19 output of this.
I like that.
Every once in a while, yeah, I like it too. I was
building the comeback. I like that.
Building the comeback. All right. Is that another T-shirt, Sarah? Building the comeback. We love prevention data. I mean, we only got a front and a back.
I think bumper stickers. We haven't explored fridge magnets, water bottles.
I'm on it. But this is what we need, guys, and I appreciate it. And we haven't even gotten to the work yet. So thank you so much. Who's next? I think Belinda, did we hit you? I'm not sure.
Belinda shared in the chat, but if you would like to
right.
clarify or talk more about what you wrote in the chat, we'd love to hear from you.
Let me throw it up there first. And she said, adopted trainings from in-person to virtual to continue education through outreach for support during the pandemic. Huge piece. If that's all you have, that's tremendous. And that's part of our build is people are trying to figure out how to do that. So we would like, not now, but going in the future, what were your successes and challenges there, right? I'm trying to build this model like, I don't know, it's kind of like parenting, right? Or aunting or whatever, if you're ever involved with a kid, you just don't want them to make the mistakes you've made, right? They're gonna make their own. So that's my hope here, is that we dialogue about our obstacles, we dialogue about our successes, and then we build from there in many, many ways. So definitely, thank you. Belinda, if you'd like to say anything else, perfect. If not, that's fine. All righty, and we'll come back if needed. We have Bridget.
And before Bridget goes, if anyone isn't comfortable, talking out loud, you can always write in the chat. You can always let us know, skip me. You can just ignore us for a couple of seconds and we'll move on. We want you all to feel comfortable in this space. And obviously we would love to hear from all of you. But we are well aware everyone spends a lot of time on Zoom meetings these days. And sometimes it's like, just please, I don't want to talk right now.
Thank you so much, Bryn, for bringing that out. Really important aspect to this. There's our flexibility again. If nothing else, you're going to see from me and Bryn that anything you need outside of leaving the meeting, we're going to accommodate without a doubt. And another little thing I found out from my students the other day, did anybody know that you can hit your space bar to temporarily unmute? Okay, I'm slow on that. I'm so slow, but my students taught me that the other day. Just a little tidbit. All right, I see Vanessa has come on. Vanessa, would you like to introduce yourself? And how we're going about this is where you're from, what's your title, and then COVID-19 work, some successes or some aha moments, or many of us have talked about our transition into having to do things virtual, being Zoom warriors, all of those things that we've added to our repertoire and our toolkit around COVID-19 through a prevention lens, right? We're going to be talking data, we're going to be talking prevention work, always is our foundation, but in this particular case, we want it through a COVID-19 lens along with those pieces. So anything you'd like to share?
Good afternoon, everyone. My name is Vanessa Batres, and I am the Child Abuse Prevention Program Manager with YCCA, and just happy to be here and learn about the data during this particular time that we are all living.
Awesome. What did you say your title was, Vanessa?
Child Abuse Prevention Program Manager.
Awesome, awesome. So you have some boots on the ground connection, right? Like you're pretty well connected to the not only the workers but the families, correct?
Correct.
So I'm working up to a point that we need you. I'm no longer in contact with families that I work with. I'm in contact with workers and supervisors. So we need voices at times, and maybe not in this meeting regularly, but maybe you become a contact for us or various things. And this is a shout out to the whole group as well. We got to have representation of boots on the ground. And I know we have it, but just want to highlight how important that is, because we've got up through the chain. So we need a little bit of everything. And if we can, we got to figure out how to invite a community voice to this meeting. Right? Do we have a family or a parent or someone who is already on this call maybe that has system experiences that are willing to share or willing to just use that as a foundation, because we're all professionals here that are working for a group that's out there. And not sure if that's a piece to this or not, but those of you that are connected like Vanessa to our families more directly than someone like me and Sarah, that's an important aspect. So just keeping in mind community voice piece. Thank you for being here, Vanessa, definitely. Who did I miss?
I'm looking through our list and I think we heard from most people. Did we hear from, is it Andrea or Andrea? That's the only person. I may have missed it, and apologies if I did.
And I no longer see her on screen.
Oh, I think she's talking in now. Hi.
Hi. I don't know if you can hear me though.
Yes, I can hear you clear as day.
Okay. Okay, I wasn't sure. So my name is Andrea Branscombe, and I am from Tulare County. I'm actually an intern with the Tulare County Child Abuse Prevention Council. So Amanda is my site supervisor, and I do work with Sarah. And of course, Adela is one of our family resource centers. So I'm from Fresno Pacific University, and this has been an exciting, it's unreal how much social work you guys do, how much collaboration, how much agencies. And I would never have seen that if I was not with Tulare County CAPC.
Thank you so much. Definitely. And again, you've got a perspective we need, right? And hearing that, like, that's what we were talking about a moment ago, right? When Esther mentioned it, we need to hear that. I appreciate that. You guys do a lot of work with a lot of counties and a lot of people, because sometimes we forget that. So Andrea, definitely thank you. So I think we've gotten to everyone. What an interesting set of introductions. And I'm so glad we recorded, not because I learned more about you, but I learned more about the successes and maybe even some of our challenges. Our hope today is to work on focus. The only parameters that we have is COVID-19 work and goal setting through a prevention lens. The other thing that I would like is us to have some level of commitment to this. And when I say commitment, it scares everybody, right? Whether I'm talking about committing to your diet or committing to your relationship or committing to me in this COVID group. It's hard. All of that stuff is hard. So I'm not asking for a commitment like, if you miss a meeting, I'm going to come chasing you. I'm asking you for a commitment about your information, about your sharing. That, hey, I can't make any of these meetings, but if you shoot me an email with your questions or whatever you're answering, I'll shoot you back an email, which will give you more food for thought within that arena. So, but the hope is for us to create a cohort. That's our hope. Our hope is for us to meet 4 times throughout the year and to have some outputs. Now, what's in it for you? What's the WIFM, right? The WIFM is that your inputs will hopefully, and I truly believe it, warrant some outputs. The outputs may not be tangible, like here's this document to go do this, but the outputs may help you with your goal setting in a COVID-19 environment. They may help you with your prevention efforts through a COVID-19 lens, because you hear what Santa Cruz is doing and you're like, we never thought of that. So my belief is the only way we can have that is if we have some level of consistency. So I hate to put it on you, but I'm going to ask for quarterly participation by a core. And if we can pull that out of today, that's my true mission. Now, those of you who can't say that, I still want you. I want you to be on our mailing list and say, I'm coming to the 3rd meeting. Can you update me or give me the recordings to the first 2? Because that's how invested I am. Shoot, we got folks riding around in cars during their introduction. We can commit to this. All right. So, and the commitment is not for you to do work. Your commitment will be for you to input to the work so we get something out of it that helps you with your day-to-day. My goal is to help you with your day-to-day, not to give you more work. And I want to facilitate that. And I think we can do it. Can I get a thumbs up? All right. That's all I need. Anybody who needs to emoji me thumbs up, there you go. See, Bryn, Marissa, you jumped right in. You know how my ego is. I need that stuff too. All right. So here was our plan. Give you a little history. I couldn't keep holding that space bar to unmute me. I'm too transparent sometimes. So I had to find my mute button. Here we go. So a little bit of history about why we brought Jasmine here today. So Jasmine and I did some work around the Sac Sierra Innovative Partnership Group. It's a grantee group through OCAP, Office of Child Abuse Prevention, where they get money to do the prevention work, right? Very little money, whole lot of work. And they have been moving along for over a decade, and it's been revitalized. And one of the things when I came in about 3 or 4 years ago was to help with that, and we did an opioid toolkit. But one of the things that was generating that group and their outputs was data, the qualitative and quantitative data. So I was very afraid to ask about it, and one day I did, and in probably about a 24-hour period with Jasmine, you probably don't even remember this, I learned more about data than I had through all of the psych classes and programs and all of those things. And I want to share that with you guys, because what it helped me do was learn how to pull data, learn how to read data, and learn how to apply it. Not that you're going to get all of that today, because that took me years to do. But what I was able to start is an understanding of why we need it, how we need it, which has led me to, yes, I love prevention data too. So the bottom line is, what I want you to sit back and we're going to give you this stuff. We're going to send it to you. So I want you to listen as much as pull up whatever she has asked you to, because we're going to do a little bit of work in some live time. But she's going to talk to us about how she pulled it, why she pulled it, what it did. Because what I believe is, in this COVID-19 environment, we need to begin to substantiate things that we already knew. COVID has just brought to light why poverty is so bad in our communities, why racism is so bad in our communities, why the inequitable treatment at schools, why our discipline practices within our schools for certain demographics. And I could go on and on and on. So COVID did not create many new problems. It created the problem of a pandemic. The rest of the problems weren't created by COVID. They were created long ago, systematically. And what we're now faced with is how we solve them. So my hope in our prevention work is, when we pull this data, when we start to look at it, it'll help us tell a story, set some goals, and get some output. And I'll continuously say that throughout our work. So without further ado, I pass it over to you, Jasmine.
Well, thank you. It sounds like I did something magnanimous, but all I did was what we what we set out to do. So what Troy's talking about, and it sounds like some folks are familiar with innovative partnerships, at least it sounds like our Fresno partners are. So our innovative partnership, or my group, is the Sierra Sacramento region. And so we are 14 counties in total. And we are diverse counties, right? So we have small counties and large counties. We have rural counties. We have very suburban, urban, metro counties. So we have really great conversations, and it's a great opportunity to learn about what prevention work looks like and all of that stuff. So I encourage you, if you don't already participate in your Innovative Partnerships program, wherever you are, definitely find out who they are and get in touch with them, because they do amazing work and it's a great opportunity. And so I can't speak to that enough. So that's number one. So what Troy was talking about for what I built was essentially just a walkthrough for our counties to utilize in order to access pretty generic data via kids data. And the reason we did that is we were doing a needs assessment, right? We were trying to figure out, between our 14 counties, where were the most crossovers of need, right? Rural counties have very different challenges than Sacramento or Placer County, so we had to have that conversation. And you learn two things pretty immediately. Number one, there's not always data for everything. And number two, it's not always accurate, right? It's not always an accurate depiction of what the challenges truly are. And so that's something that came out immediately in having this conversation. And I think with that, one of the things that that taught me, just kind of as a data person, was just that you needed to always go the extra step, show people not just how to access data, but also how to source your data and find out why and how this might not be reflecting what you're expecting it to reflect. And so that's something that also kind of comes out of this process. So I hope that it's not super boring that we're doing kids data stuff, because a lot of people use it. A lot of people are super familiar with it, especially with COVID-19. They've been one of the great people to kind of collate and grab some of that data and put it in one centralized location. So I will kind of walk us through how to access some of the more recent COVID data. I think one of the, well, there's two things I want to talk about before we get into that. One, Troy was talking about opportunities to get that qualitative and quantitative data even within this group. And so while everybody was talking and sharing and talking about all their experiences with COVID-19, I started just kind of jotting down all the different things that I heard people talk about, right? And just kind of summarize them in 1 or 2 words as best I could. So I just popped it in the chat for you. And essentially that's a great opportunity when you're talking about your COVID-19 stuff and you're looking for data, especially if you're looking for comparisons, right? There is no point comparison to COVID-19. But these are the kinds of things that we were talking about in this group already. So adaptability, deliberate and intentional service delivery, showing up at the table and participating in everything you can, collaborating, being proactive, revising how you promote, flexibility, community voice being important, and your scope of services, just being aware of what's out there. So that's the kind of qualitative data that I like to pull. I like to pull from meetings like this where I hear everybody talking about different things, different perspectives, and just make note, these are the things that I need to zero in on, right? This is where I can learn more. So that's lesson number 1, essentially. And then the second half of what I was going to mention is just that one of the things in COVID-19 that's become very clear is how long it takes for real data to come around, right? So for those of you that are super familiar with data and those processes and how to collect and everything else, you have probably a good understanding of the amount of time it takes to get good comprehensive data in place. So it was maybe 6 months into COVID-19 before somebody called me asking for data. And for me, for child death review stuff in particular, that data takes years for us to go through, to review, to publish, to do all of that work on. And it became very clear very quickly that this was stuff people wanted yesterday, right? They all want to know what's going on and where to send their services. But it also very much showed a deficit in where we weren't tracking things, right? We heard about domestic violence in this group already and how domestic violence providers knew immediately that this was going to be a problem and that they took, it sounds like, some really great proactive steps to kind of address that. But I think for the rest of the world who doesn't do that work, it was not a proactive thought process. It was not us thinking this is the problem and this is where we need to pay attention and provide our resources. And so that was something that even in my field, it was something we considered, but it also became a point of measurement. That was something that we could measure and use as a proxy for those missing mandated reports, for those, child abuse and neglect reporting things. Those are getting left out, but we could use our scale up in domestic violence calls as kind of a proxy on some level to say, look, things are getting worse in homes. There are more challenges, even though we're not getting those reports doesn't mean that that stuff stopped happening. It just means that the reports stopped happening. And so that's another thing I think that, it always is going to take a while for the data to catch up with everything that we want to learn. So even though we're going to go look at some kids' data stuff today, I just think it's important to acknowledge, number one, it's not comprehensive, right? It's as much as people can get in the short time that they've been able to start collecting data. And number two is that it's going to change over time. The more we look at it and the more we refine it, the more we're going to realize just how different the impacts really are. So I don't know, Troy, is there anything else that you want me to do before giving kind of the walkthrough on how to access or any instructions on what you want to access? All right, well, since Troy bowed out for a second. I will, I'm happy to just kind of share step by step. It's no big deal. But essentially, one of the, like I mentioned before, the other kind of trick that is built into kids' data is always making sure that you're looking at where they cite their information, right? Kids' data is not the party going out and collecting this information. They're the third party who contacts other people and gets their data and then puts it on their site and just kind of hubs that data for people to have easier access. So I went ahead and just kind of did a step-by-step on how to access their COVID data right now. And then I also took a bunch of, I saved a bunch of links to other sources and source materials. So I'm happy to share that after the fact so that you don't have to do the work and go and find where they sourced all their materials. But it's a great, it's a great idea to go and look at where that source material came from. I think that sheds a huge amount of light on not only what they were out looking for, but how many people they talked to, how they talked to people, because we know, okay, so number one, right? We know that people who don't have access to internet or online services are not participating in surveys right now because nobody's showing up at their door. So that might be a challenge unless you're doing phone call surveys, which just aren't done as often anymore. So that's one of those things that I think gets really kind of taken for granted, is that when we do our data collection, number one, if you have time to fill out a survey already, you're already in a specific situation. And number two, if you have access to the internet and the opportunity to fill out a survey, you're also in a different situation. So it's great to keep that stuff in mind and to know how people did those surveys before you even look at the data and the outcomes. Some of the other sources, so I also have gone out and found some other sources specifically for Sacramento area, but there's some others that kind of branch out. A lot of them did a review of like income and number of kids in the household and information like that, that really show that it was it's very diverse in what the income looked like for those people, but we had a good portion of folks in that were 400K a year incomes. And that's different data than I think most of us are looking for in the prevention field. Doesn't mean that it doesn't happen. It just means that it might not be an accurate reflection when it comes to food insecurity and deficits in childcare and things like that. So as you see those kind of numbers revealed, people start to say, oh my gosh, well, only 5 of 8 people said they had adequate childcare. So it's not as big of a problem as we thought it was. But that I don't think is taking into account people who couldn't access it to begin with, right? And financially, that's a very different thing to look at. So I'll stop talking. That was a ton for me to just pour out, but I'll pop in just some step-by-steps how to access kids' data and what their COVID-19 portion looks like. And then I will let Troy and Rosalind, I don't know if you guys have a plan for what you want that to look like. Okay, Bill, I'll let you go ahead and share what your plan is for that.
So right now, this is way more of just a how-to, because what we're going to do next is then we're going to have a dialogue about what we're going to do with this. Is data going to be our foundation? Is it a piece of our foundation? So it will inform our conversation about usage.
Yeah, and I'd like to add to that, I do have some resources on data that I'll be adding so that people can look at them, just a few reminders about data, things to keep in mind when we're looking at data. And I can share that after the presentation.
All right, so I went ahead and shared the step-by-steps. So I'm not sure if folks want to take some time and go and have a look and bring back whatever conversations or questions you might have. It's basically just navigating to kids' data and then the quick navigation to just the overall COVID data. I will say that most of this, it says California only. It is kind of separated out by lumps of counties, but definitely not by individual county like some of the kids' data sometimes is. So if you want to, I don't know if you guys want to just pause or take a minute, but that's, I think, the next step in the process.
Did I miss something?
No,
Nope.
I just shared the step-by-step in the chat box. And then you had said you wanted people to just go navigate to the site, check it out, and then bring back questions and comments, right?
Definitely.
So that's it.
So for those of you who might not be able to access kids' data right now, I just thought I'd share my screen and show where you can access it. So I actually haven't accessed this COVID-19 pandemic, so we'll test out Jasmine's instructions. So let me screen share really quick.
Thank you so much, Bryn. I was doing that, but so much slower than you. So appreciate it.
I think when I was reviewing it, I was curious to know, I think there was some help, stressful but positive, helping with like school engagement. But I'm wondering, and I don't know if it has it somewhere in there, as far as what those challenges might have been. Were they like language barriers? I'm not sure if that goes into further detail.
So what we're going to do, bring that, Adela, back to our group. That is a perfect start to when we come back as a whole. We're going to start with that first question and see about how we go about navigating through. Excellent question, definitely.
Yeah, then you would click on data by topic. I think that's where the next tab would be.
Yep, so that's where I was going next. So as you can see, it's really easy, just kidsdata.org, data by topic, and you scroll down. I've used a lot of these tabs before, and you can just expand COVID-19 pandemic, click on it. You have all sorts of these really specific indicators, which is really nice. Or you can go here to summary. And it'll pull up a lot of information. You can customize the chart as well and say which ones of these that you want if you were going to pull like a PDF report. And in doing that, you can pull by some specific regions, which will list which counties are included in each region. Which is really interesting. So
So as Bryn continues just to navigate, for those of you who aren't able to, we'll give it a few more moments for you to just kind of, I don't want you to necessarily set a whole goal plan from looking at this, obviously, you know, but I want you to click on some things to get an idea, because now what we're going to do is talk about how could you use this? Or is it something that's, nah, not right now. So give it a few more moments. If you're able to navigate, please do so. Bryn will continue to navigate just to show you some of the options, and we will come back in a moment.
So yeah, I'm just clicking around. This is the sort of summary, and you can go up here and it'll give you some different charts. So that first one we were looking at was the school arrangement. So which school, or not which schools, but percentage that are fully remote, fully in person, or a hybrid system. And it also tells you when the data is from. So this is from from November of 2020. Most of California was fully remote, which, I mean, I think we all sort of knew that, but it's interesting to see the numbers as to how many were actually in hybrid or fully in person at that point.
And Bryn, just to speak to that, I often have been using data just to prove what we already know. Sometimes in our work and in our trying to get grants or whatever, this is super important. Like childcare closed, that's a huge stat, right? To understand and to put into our understanding of the work we do with our families, our families that are challenged by the various things and the systems they're in. Childcare closing changes lives. So definitely appreciate this.
Yeah, I'm looking at some of the data. Does anybody see any type of data that's very interesting to them, that they've learned something new about? I can also share something that I've seen. So I'm looking at, since we're talking about prevention with child abuse and neglect, I'm looking at physical and harsh verbal discipline of children in the past week by household. And so it also lists like children with special healthcare needs and status. And so that data is showing that children who have special healthcare needs are being abused at a higher rate than children without special healthcare needs. So that might be something that we want to look into when we're thinking about child abuse and neglect prevention. Who is being most affected, which children are being most affected.
So I just pulled up the data that Rosalind is talking about, and you can look by county. So I've selected it all, so it'll break it down. Here's all of California.
Yeah, so if you go to the table, without the breakdown, if you just go by California, so I can share my screen if that's helpful as well.
Sure, yeah.
Definitely.
Can everybody see that? Yeah, so you can see that for households without children with special healthcare needs, so children who were spanked, slapped, or hit was 13.5%, but for households with children with special healthcare needs, the percentage of children was 24.8%. So it is higher. So that's something that we want to look at. We might want to look at when we're thinking about prevention. So it looks like, children with disabilities may be experiencing, higher rates of abuse, right? And that might not be something that we typically look at, and this information is now available. So it also gets me thinking about who are we not typically screening, right? Where are there gaps in our outreach? And when we're screening, are the screening service, is screening accessible and inclusive? So these might be some things to think about when we think about child abuse and neglect prevention. Which children are included, which children, maybe at increased risk, because, we think about how violence thrives in silence. So which children are most silenced? So these are just things to think about. And I'd be happy to hear if anybody else has seen some type of data that as they're going through this, that might be sparking ideas for them or getting them to think about prevention in other ways.
That's a great segue, Rosalind. Let's all come on back, because Rosalind has given us another t-shirt. I don't know if you guys heard it. Violence moves in silence. It's a bad one. It's not a good t-shirt, but wow, what a powerful way to put this information out there, Rosalind, with regards to what we do. So that's stolen. So let's open up the door. Does anyone I need to know questions about the data, and I'll start off with one that was placed into the chat, and I want to know your aha moments. I want to know if this was good. Can this help? Did you already know this, and how will you use it in the future? But the question was about sample size. Bridget asked, and I believe she was asking, posing it to Jasmine. It says, yes, very helpful to know about this data. Sorry, you may have said this, but what was your sample size?
Yeah, so if you, and I don't know, Bryn or Rosalind, if you want to bring it back up, we can look at how to find your source data. It's not mentioned anywhere in the kids data screen, but if you go to your source data, you can usually find that information. So in this particular instance, for the data that was pulled using the, oh my gosh, what is it called? It is the Reasons for Hope Pediatric Perspectives data. Yeah, there you go. So, so there's your source data at the bottom. It also is going to tell you what all those little points mean. So like the exclamation point has to do with margin of error. So there's a possibility of about 5 to 10% difference in those ones with the exclamation points. It just means that it could be a little higher or a little lower than what's given. And then there's also the S's that you might see when you look at some of the other data. That's suppressed data. So those suppressed data points, yeah, so you can see the exclamation point there. That just means there's a possibility that that could be anywhere from 5 to 10% more or less. They're just not, 100% sure. And then when you come across the S's, that's suppressed data. And it just means that the possibility for error was too great. They just weren't confident with the data that they had, and so they didn't release it. It wasn't that they didn't collect it. But yeah, so down at the bottom of the page, there's the citation information. And that allows you to kind of go on a hunt for yourself. So you can look up your data source material. So in this case, I was able to go and find the source material, and I will post it in the chat as well. And I'll post the link to the site where that information is. But to answer the actual question, what was the sample size? This was something that was done in multiple waves. So they've completed waves 1 and 2, and I don't know if they've completed wave 3 or not yet. But each wave was estimated to be, their plan was to do 3,000 or so parents per wave. I believe by wave 2, they had almost 7,000 parents. So they had more than they had anticipated by their second wave. But they are looking at change over time, right? So they're doing those waves over different periods of time to see if those numbers change or shift at all. So when you see wave 1 at the top, that's what they're talking about. So that's about 3,000 people when you see wave 1.
Thank you so much, Jasmine. So group, anything hit you? Any aha moments? Anything that you pulled this data and it was like, interesting?
Hi, Troy. This is Amanda from Tulare County CAPC. I have seen this website and found it very interesting, and when I'm writing grants and stuff. But one of my aha moments was, and I looked it up again, and it's the one link on ACEs by number on adverse childhood experiences, and so I pulled it up and. I don't know. I think probably I'm concerned. And here's why, because we base all of our program services on the ACEs study and you know, we provide training on ACEs and how it affects development. We provide training for parents on, you know, the fact that as adults, we bring our ACEs, you know, to work. You know, we bring our ACEs into our parenting. And then I look at, and it says that there are 65.2% in Tulare County with 0 ACEs. And I think, okay, just this past year, I don't think there's anybody on the entire planet that has an ACE score of 0. And of course, that's just my opinion, but I really feel like so much of what we've done this past year has been in isolation, you know, parenting, and that has caused so many, you know, our children have changed, we have changed, the world is very, very different. And when we look at those initial first 10 ACE questions, we've expanded that, and we know that there's so many more than what we just, you know, those 10. So it's hard for me to look at this and justify why we need funding for this stuff when I have these numbers that say, well, 65% of our county doesn't have even one ACE. So so I look at this regularly, but I don't always use it because it doesn't support what, you know, our mission is and why we do it. So that was just kind of a aha for me.
Yeah, Amanda, thank you. Thank you so much for sharing that. You're right. I mean, a lot of times the data isn't reflective of what we are experiencing. And that's a great, thank you so much for bringing that up, because I do want to share like a resource that I've created for folks, just as a reminder for what to look for and just to be mindful of when we're looking at data. The importance of being data informed rather than data driven, because as we know, there are gaps in data, right? And data isn't entirely reflective of our experiences and the experiences of our communities and the experiences of people who have typically been marginalized. And that's something that, you know, that's why lived experience is so important, because, you know, we can have figures and numbers and different things to measure things, but again, not everything that counts can be counted. And not everything that's counted counts. And so I do want to share, I'm going to drop the resources I created, and then we can go over them if that's okay with everybody, if everybody's open with that. Okay. But yeah, thank you so much, Amanda, for bringing that up. That's a very valid point.
I dropped something in the chat also that, you know, when it comes to ACEs data, a lot of times it's a really tricky thing to measure because most data when it comes to ACEs is retrospective data. So you're asking adults what they experienced in childhood. And if you ask adults now, their childhood hasn't changed, right? So they may still have 0 that they experienced, you know, however many years ago. But that doesn't actively reflect what kids are experiencing right now at this moment. So yes, ACEs data is one of those very tricky kind of elusive things where if you're not talking about what is actually happening, or if you're trying to paint a picture of what's actually happening in this moment now, it's not something that you're going to really find accurately depicted in that particular measure. I do think that there's a lot to be said for just knowing how they measure it and then saying, look, we know that this is happening. But again, Rosalind said it great. You know, you can't always find that number that's going to make sense.
So Jasmine, how do you, what would you recommend for those of us that are trying to either, you know, do some grants based on ACEs, whether it's ACEs Aware or just, you know, trying to convey that message when we don't have the accurate data right now to support that? What would you suggest?
Yeah, so I think a lot of times what it really boils down to is having a place for community voice, right? It's using the qualitative data as opposed to quantitative data and saying, even if you can find 15 resources that give you numbers, when I talk to families, this is what they tell me. When I asked moms, this is what they expressed to me. And that's, I think, far more powerful, especially when it comes to grant writing. To be able to say, in my community, I have these connections and these parents share stories with me, and those stories speak volumes that are outside of how many you can count, right? So I think that honestly, community and parent and family voice is far and away one of the most powerful tools you can use when it comes to data. And I think another option is using forums like this, right? Where you can have conversations, and like I popped, 15 words in the chat that says, these are all things that we've identified as challenges across the state, right? We came to this community forum, and the community forum expressed that these were the things we needed to build, and this is how we're going to use this money to build these things in our communities. I think the truth is that we lean in a lot on qualitative data as opposed to that quantitative data. That being said, there's going to be some exciting stuff coming out. We do have a great benefit in the medical field now getting reimbursed with Medi-Cal and having that opportunity to screen kids as kids and getting some true and accurate measures throughout their childhood, as opposed to doing these constant retrospective examinations of that. So I think that that's something in the future to look forward to. But for the time being, that's honestly the direction I would go if it was me.
And just to jump in and piggyback a small thing on that around qualitative is, I coined a phrase a few months ago, and I haven't heard it yet. Information hesitancy, right? We talk about vaccine hesitancy. Well, we are very aware that our Black and brown folks are very private with their information often. And is that a blanket? Yes. But is it the truth? Yes. Do I have research on it? No, but I know. And information hesitancy. We're not sharing the information with the data collector. Is it because the data collector doesn't look like me, or I don't trust that data collector, or that data often is collected and I feel like it's put in a place that is detrimental to my community? So information hesitancy is, to me, one of the reasons this information is inaccurate, is because the data collection is flawed. So just another piece for that to be added to it in that conversation. I'm looking for mad research, because we got to put that in our requests for funds and our looking into grants, that, hey, you guys are asking us to base this information on inaccurate data, and it's because the system's not collecting it correctly. There's a different truth out there. So I appreciate you bringing that up and that question, because that's why this data thing is so complicated. Data is for liars, and liars use data, and bottom line is, we've got to figure out how to massage it to our benefit, because it's been massaged to our detriment in many ways.
Everyone's okay. I can share my screen. The document I uploaded is taking a while, so I can share my screen. I would say that data is a tool. Okay, I wouldn't call everybody who's using data a liar. That's just that's my stance. But I would say that data is a tool just like any other. It's applicable in certain situations, and in other situations there are other tools and other resources that we can use. So yeah, I'll go ahead and share my screen. Can everybody see that? Yeah, and so the reason I created this was kind of to demystify data, because I think data for some folks can be intimidating. So I just want folks to realize that data is just another word for information. And that, with all the data that we have, data is inherently biased, right? Because we are the ones collecting data. We have our own implicit bias, whether we're conscious of it or not. And so that's something to be mindful of when we're looking at data, right? So when certain types of data are presented to us, we want to make sure that we recognize that, this might not be exactly the truth of what's happening. This is a perspective of what's happening, and there may be biases inherent in the way it was collected, how the data is being interpreted, right? Ways the data is being utilized, and ways that data is being disseminated, right? Who has access to that information? Who is being excluded from that information? Is that information accessible when we're sharing it, right? And then another thing I also wanted to share is the importance of being data informed versus data driven, right? So it's the idea that data is informing our decisions, not driving our decisions. Because if data is inherently biased and we're using data to drive our decisions, then we're making biased decisions, right? So that's something to keep in mind, is that we want to use data as, you know, a part of our overall decision-making process. Just like Amanda said, right? When she looked at this data, it wasn't aligning with what you were seeing and experiencing within the community. And that's really important. You have to trust that. You have to trust in your experience, trust in your background, your knowledge, what you know about the people you are trying to serve, the children you are trying to serve, and remind yourself that, you know, this data may be saying something, but it may not be representative of your community and who you're trying to help and serve. Okay. And then, yeah, so with the understanding that there are gaps in data, underreporting, and data is inherently biased, being data informed means data is included alongside other information, such as lived experience, right? There's so many experiences that we can't capture qualitatively or quantitatively, but have an impact on who we are as people, right? And, you know, people might have unique backgrounds and insights. They might have, you know, unique experiences with service providers that affects how they're able to access services. And so another important consideration is that, again, not everything that can be counted counts, and not everything that counts can be counted. So there are exactly with what we're talking about with who is being screened, who is being left out of the data collection process, right? So who's been systematically excluded, right? Are these screening instruments accessible, right? So if, for example, from that kids data for children with disabilities, have they typically been included in data collection? Or which populations have typically been excluded because of access, or because of, you know, they just have been marginalized, specifically too when we're thinking about homeless youth, foster youth, who has typically been excluded from data collection, and whose experiences have we not been able to, you know, more accurately represent because there's biases and systematic exclusion. And then, so yeah, these are some of the questions that I have. So what types of abuse are we not screening for, have difficulty screening, or are underreported? So in terms of thinking about the pandemic, you know, in talking with different child welfare directors and in talking with different folks, there's different types of abuses that have been extremely challenging to collect data about, specifically child sexual abuse, right? Because it's a lot of mandated reporters are interacting with children via telehealth or, you know, via Zoom, and we don't know who is in the room with the child. And so it can be dangerous for a child to disclose, especially if an abuser is within proximity. And so we have to think about too, is like, what are other types of abuse that children are experiencing that we don't typically screen for? For example, street harassment, is that something that we typically screen for? Microaggressions. What are the different types, like cyber stalking? This is something that adolescents are experiencing. There's even, you know, anecdotal accounts of, you know, people exposing themselves through Zoom meetings, right? And so that's something that's very new. There might not be data on it, but it is happening. So these are things that we kind of want to think about. What types of abuse are we not screening for, have difficulty screening, and are underreported, right? And then who are we not including and counting? Are our plans and processes accessible? And what are we missing? So these are just some questions to think about when we're looking at data, when we're kind of thinking about our decision making, right? Because I know a lot of us have to use data to make decisions, right? And so we kind of want to think about the limitations of the data available, and yeah, and what we can do. And so another important consideration is aggregated versus disaggregated data. So with aggregated data, you know, it's looking at a larger group, but then you don't really get that person's unique experience. It can be challenging to interpret, right? So one of the recommendations is using disaggregated data to help with understanding the experiences of persons from a group within a larger population. For example, with race and ethnicity data, sometimes they might have, large umbrella terms for race and ethnicity, but when you break that down into smaller groups, you might be able to see that, the experiences are not uniform across the population. So that's something that's really important to consider as well, disaggregated data. And then community input. So this is something that was brought up before, and it's the importance of including the community in the data collection process, in analyzing that data, in looking at that data. It's the idea of, nothing about us without us, right? And that's from, the civil rights movement and disability advocacy. So it's the importance of including community voice, including community input, right? Because we also have to think about privacy. Because when this information is collected, who benefits from this information? And how can we best protect the privacy of populations who have typically been marginalized or have been exploited through data collection? Okay.
Awesome. Thank you so much for that, because that's going to be an ongoing aspect to this work, Rosalind, that I'm going to need you to probably revisit in future meetings. So hold on to that so that we can definitely continuously bring up how we use the data, because and what we've got to keep in mind. You made another T-shirt. I don't know if that's yours or not. Not everything that counts can be counted. I mean, whew, right?
No, I can't take credit for that.
You can't take credit for that one, but I heard it from you.
Quote.
So
I can't take credit for that.
Well, yeah, I heard it from you, so you got the credit.
Due.
I mean, what a powerful statement, right? So I want to move on purely because of time. We got like 30 minutes left, but also to let you know that data is an aspect of what we're doing. Our focus is prevention work in COVID-19 environment, but we can't do it without data, right? So that's why we started here. What I want to do next, so keep all of this in mind. We're not putting it away. We're just putting it in a parking lot for just a moment. The important aspect I want you to pull from that is I need it. I need this data in order to set these goals. And I think we're already there. Maybe it was just me that had to be convinced of that. Amanda, you started this conversation with your question. I so appreciate it, because that's what this group has to be about. I'm hoping that we're all learning from this. And next, I just want to point out that I President Obama'd this meeting by putting a lot of smart people around me, right? I could not have done this without the grouping around me. Smart people make this work, so I appreciate my group. So let's talk a little bit about what we're going to do next. I want you all to pull your calendars out. We're going to set a date to come back together. If you can't do it, I still want to be in contact, but if we can come back together to start to solidify this, we're not going to solidify it today. We've got to figure out what our learning community, transitioning to a learning exchange. See, y'all thought I messed up, or those of you from my team, and I called it learning community, because next we're going to talk about what that looks like. Let's talk a little bit about what my and this group's expectations can and should be for us. So let me share my screen. I'm a little slower than the rest of the group. How's that? Can everyone see that? Awesome. So what I wanted you to do is just be aware of our core values as far as these learning exchanges, as well as strategies TA, right? We want to be accountable to the field and accountable to each other. And equity and inclusion is one of our foundational values. You have heard each of our folks that have come on here talk something about community voice, because we realize it's often left out of this work. We truly believe in collaboration and are a strengths-based organization, strengths-based process supporter, a supporter of strengths-based process. I kind of got jumbled up there. But this is what we want to live by. And this is what we want our learning exchanges to do. So let me speak a little bit to you about what some of our expectations are. So learning exchange cohorts are going to be our path to deeper learning, and I think we achieved this today. I think we began to talk about deeper learning. We had some questions. Rosalind came in with her level of knowledge. We started with Jasmine's level of knowledge to open this up. Bottom line is we were truly able to begin the process of information sharing that I feel like is truly useful. We're supporting prevention planning teams in this work. And these are the other areas that we're going to have some learning exchanges in. Now, again, we want them to be a cohort, but you're more than welcome to go there, more than welcome to gather that information or see the recordings. But the other areas are in our rural communities, community engagement and building communities, resiliency, and equity. So those are going to be the areas that we cover with a prevention lens. We had learning communities prior to this. What are the differences? Why are they different? Participants as members. There'll be members of this cohort. This is not my group, this is our group. And it's gonna have to be member driven. Now, the difference is I'm gonna hold your hand until we pass that torch. So what I'm gonna do between now and the next meeting we decide to have is gather this information, pull the team together that helped me with this. What can be our next steps, right? And then give that to you as a group to begin to mold this, to get out of it what we need. But the topics will emerge from participation as well as our participants. And I think that started to happen today. We're starting to talk about our needs, what our interests could be. So my question to you is, with this information about our movement from communities to exchanges, from moving from learning communities to learning exchange cohorts, do you feel like you fit? Do you feel like this conversation could be beneficial? And maybe even beginning this dialogue about what we could use this meeting for. I have some ideas, but I'd like to hear from you first. I'd like to hear from our team first. And it could be our team, like internal team as well. If you guys have ideas, I want to hear from everyone, without a doubt.
So what was your question, Troy?
So, and I know I talk a lot sometimes. I talk in circles. Basically, what do you want this to be? Okay. Right? How can we use this?
Right, right. So and I'm going to speak on behalf of Tulare County CAPCs, because we are in a place in our program where we are writing our new strategic plan. And for us, you know, the great part is that OCAP just released, you know, their new strategic plan, and we've also just released the best practices for CAPCs. So that helps me as an organizational leader to make sure that our county is aligned with what, you know, the state expects from us in terms of our role. So I am really looking forward to having this group help guide that Tulare in that process, you know, and to make sure that, and of course we know that, you know, every community looks different, and it should, because it means we're meeting the needs of our own community. But I'm just really, really grateful for, I like data too. I'm one of those, I have 2 t-shirts, not one. But I think because I'm new, I just finished my 2nd year with CAPC, and I'm still reading my job description, you know. But I think this is going to help us as a county. We are one of the counties identified to do prevention planning. We do have a group. We have a very active. Rosalind and Sarah know that I'm you know, they get regular emails from me because we are trying to, you know, rejuvenate our prevention planning team. But I think this is probably going to help me to deliver that message to my county with the data, you know, and you know, it may even get to the point where we don't even realize what we don't know, and this is going to help me discover that. So that's kind of my hope. I just want to make sure that I'm reading my job description correctly, really.
Thank you so much, Amanda, for sharing. I love hearing your enthusiasm. I love the representation of Tulare County here. Yeah, I think the purpose of this learning exchange is to support you all and how you would like to see, you know, this work moving forward, how we can support you. It's driven by the participants themselves. I mean, I provide information, but it's to supplement what you think you need to be able to do the prevention work that you need for your community. And so that's what we're here for. And I'm happy to support. You have my contact, and I can put it in the chat for anybody else who would like to get in contact. But yeah, this is what a learning exchange is for. It's to learn with and alongside each other. We won't all have the answers, but we have our own experiences that we can share, and we can work together to kind of find innovative ways that we can deal with things, because realistically, a lot of the challenges that we're experiencing right now, we haven't experienced before, right? The pandemic is very new for everyone. We know that there's going to be gaps in data. And so this is, you know, an opportunity for us to kind of talk to each other about the strengths and challenges. What is working for folks in their own line of work, and what can we learn from other folks? And what can we do to problem solve together so that we're making sure we're centering children and families, and making sure that we're focusing on child abuse and neglect prevention. Because I think that's why, you know, we're all here, we're all passionate about the work that we do. And this is just another, you know, space and time to be able to talk about things that are, you know, are challenging for us. And, you know, we're all human, we're all learning. None of us have all the answers, but we do have some answers, and we do have some experiences that we can share.
Definitely. Thank you, Rosalind, especially for those explanations of continuously putting into everyone's head what we want out of this, right? Saying it over and over. Does anyone else have any feedback with regards to how we use this time? I mean, I think it's going to grow. I think it's going to evolve, but do you have any ideas right off the top? How about I read one from the chat while you're thinking? Bridget just jumped in and said, I would like to be able to be more informed about where the data comes from, so that information that I take back to my organization is informative to our legislative work. Definitely. And I think that goes into the data pulling, the data collection. Jasmine talked a little bit about that. But those are the sorts of things we bring back to this group. And then what we would want to know is, did we help you? How did you go back and tell that other group, and what were the outputs? So then we can come back and share it, so someone else may have to do it at a future endeavor. So those are the sorts of pieces that I feel like this cohort could bring out. Is there anybody else that would like to speak up, not from Tulare, because Tulare, this is going to be our group, I think, but we'll let other people in, but it's going to be the Tulare group, and then whoever comes around concentric circles. No, I'm just joking. But is there any, and Tulare, you could speak up too if you feel like it, you know, but I was like, whoa, 2, 3, 4, whoa, we got something happening here, right? And this is all, Rosalind, thank you for your invites. So anybody else though that has anything to give back with regards to this, this meeting, its future, how we go about doing it? Does this direction sound good? So this is when you can use your emojis. You don't have to come your camera. You don't have to come just thumbs up. I got a couple thumbs up coming in. Definitely.
Troy, I mean, I'm from Tulare County. Sorry.
No, come on. You're our backbone now.
No, but you know what? Even going further than that, we are representation. At least, you know, I heard Fresno County, Tulare County, Kern County. We're all here in the Central Valley, and sometimes I think being from the Central Valley, there's a lot happening up north. There's a lot happening down south. And sometimes I feel like, you know, the Central Valley just gets missed. A lot of the data is not reflective of, you know, what's happening in the trenches with our families. So I think for me, it's, you know, identifying those gaps and ensuring that we give a voice to those families that we're working with. I mean, we've seen that with the census as well. And it's where and how can we be efficient and intentional in gathering that information. We are those trusted organizations where, you know, we establish those connections with those families. So now what? Well, how can we effectively gather that data to be reflective of the populations we work with? So, you know, that's just my tad bit on that.
Definitely. And that's such a wonderful commentary to it, because we talk about food deserts and all of those sorts of things. What about service deserts, right? What about the lack of service provision? I learned when I got out here, I came from an urban setting back east. And when I got out here, I realized that the work that I'm doing from Sacramento all the way up to Del Norte County looks different than the rest of the state. There are some service provision gaps and some service provision deserts. And guess what helps that? This Zoom stuff is going to really help that, because we don't have to get everybody to come into a room now. We all now believe we can get this work done through Zoom. So service deserts can be attacked. And that's what I want this group to be able to do. That's what I want us to be able to start to address. So if Central Valley becomes our focus, then that's our focus, right? If Southern region and Northern region wants to come in and benefit, great, because I truly believe no matter what we do, there'll be a statewide benefit, but there's going to be a benefit to those that invest first. Early investors get early outputs. Tulare, you're my early investors. I'm going to get a Tulare t-shirt. So, go ahead.
I'm going to jump in.
Definitely.
Fresno over here.
Thank you.
No.
I'm still trying to like absorb this. When you say what are the differences between, you know, Fresno was one of the first learning community consultants when this all started. That's when I met you, Troy, down in LA. So, and then it went to Bakersfield, Kern County, and then it went to Stanislaus and kind of stayed there now. So what is the difference? I mean, other than we're getting more input on how it's organized?
I would say the major difference is we're trying to make this much more of a work group and less of a training and presentation group. So far less of us bringing you a subject matter expert, you listen to them, and then you say, all right, I got 4 questions and now I'm going to go back to my office. Well, what I would like is for that subject matter expert, after we've done some work and I send our homework to that subject matter expert, they come to our group like Jasmine did today, and their teaching is more collaborative. So I don't want a training where you just leave. I want at the end of this to say, we started this on April 30th, 2021. And here on April 30th, 2022, look what we did. Amanda now has this. Rosalind gave us this. Sandra got this out of it, right? Bryn brought this to our attention. And here were outputs. Some of them are qualitative, some of them are quantitative, but we can document it. Whereas with the learning communities, all we had was evaluations that said we did a good job and we have great presentations. I want outputs. I want to be able to say, here's something, right? And that's not just, I say, I want, OCAT wants, we want, strategies wants. So what we've realized is we're moving this from a presentation to a cohort, and cohorts do work, and cohorts meet, and our meetings aren't going to be about hearing a presenter. It's going to be challenging the presenter. Hey, here's what we need to know from you. And we're going to be able to hopefully tell them ahead of time so that our meetings are far more productive. I can't pull 4 and 5 hours from you guys. I got to get a really strong message across to you in 2 hours. Does that help?
Yeah, that helps a lot. And that sounds good. I just need you to confirm it because that's what I'm reading on your PowerPoint slide here. And like I told Russell, when we first started this, I said, well, we're already doing a version of that with our children's advocacy roundtables.
Okay.
Where we're trying to, but we just, you know, FCAP's capacity is very limited. We're very, very small.
No doubt.
So that support would be great.
Yes.
So I like the idea. I'm like, I just got an email during this this session here that, you know, because homelessness is so bad in Fresno. I mean, it is incredibly bad. Mm-hmm. And so we're pulling together another task force, and then FCAP's always invited because. So yeah, I'm in. This sounds great. I like it.
Thank you. Yeah, I think this came from, counties expressing that they wanted to know what other counties were doing and how they could collaborate with each other, and also do more information sharing rather than having information just presented. So I think that's where we're trying to go with this. It's just to provide a space and support so that, we can problem solve and work together on issues that are really affecting folks right now.
I'll add something too. I'm sorry I'm off camera. My internet has decided it's over the week. It's had enough. But I'll just add, like, unless you bring people back together more than once, the amount and the depth of sharing that you can really offer to another county or to someone else is so limited. Not only because that relationship is not there or might be more surface level, but it's just the amount of time, right? You feel if people truly want to know what other counties are doing, you have to create a space and time to really do that, to really get in the weeds of that, to talk about it. Otherwise, it's just going to be real quick on a webinar. You come in, you go out, and maybe you got a little bit of info and that was helpful, but you didn't get to dive into it with that person, or you didn't get to really hear, like, for Fresno, what Tulsa's doing, or what, some of the other counties present here are doing. I mean, I know you all talk, but you can't really get that space with someone unless it's created and intentional. So I imagine, at least for the groups we're working with doing learning exchanges, that's really something we hope to offer to counties.
Yeah, and this is definitely, the participants set the pace, you set the time that works best for you, and then we just help support it. And so it's really, based on what works best for you, because we don't want to add any extra work to your, you all are all very busy as it is. And so we don't want to add any extra work. We just want to make sure that, you can communicate with us. What time works? Is it next month? Is it, 2 months from now? However that time frame works for you, then we set it up, right? We make sure that, the space is available, the time is available. And then that way, you guys can all communicate as best as you feel comfortable, and however, whichever pace you feel comfortable with as well.
And what we would like is a little bit of regularity with that. We definitely want to fit into your schedules in your space, but we don't want to lose it, meaning lose the energy, lose the momentum. So what I would like to do is set up our next meeting and then set up our calendar in the next meeting, between now and the next meeting. And I'd like the next meeting to be at the end of the month, where we all come back together and then we solidify it. We solidify some of our outputs or some of our wants, but mainly we solidify our calendar. We can agree that we're either coming or sending somebody. And Tulare, you got the best situation. You got 30 people. You can just pick 2 people to send back. But in that time, my work will be to grow the group. There are a few people who have committed to the group already that aren't here, that are from my county. I have a Santa Cruz person and I have a Contra Costa person. So that'll be our work for our learning exchange facilitators to see who else is interested. And then to get on our calendar, kind of in a systematic way, once a quarter, with potential prep planning meetings or just emails in between. I refuse to give anybody more work. I refuse not to get to the end of this. My goal is to get to the end of this and say it was worth it. And our worth it has to be operationally defined in what we want out of this, what a learning exchange should look like, and how we're going to get there. So those are going to be our pieces moving forward. So what I'm looking at is the 27th, 28th, and 31st as potential our next meeting. Now, we had some dates that we already had sent out to a grouping of you that came back. Rosalind sent that out, and I appreciate that. And 28th, the 27th was one of those dates. I would prefer the 27th or Monday the 31st. How does that sound to the group? Is anybody?
Monday's a holiday. Are you talking May 31st?
Ah, thank you. That's why we're a team. You're right. So now that you brought that to my attention, we probably don't want to do it around that. So why don't I do this? Here's what I'm going to do. Instead of us deciding now, I'm going to table that. We'll get a poll out to you, and we'll look at that previous week of May or June. And the reason I'm saying that is I want it to look a lot like this, less Jasmine. Jasmine was our teacher today, not less Jasmine coming to the meeting, less Jasmine just presenting. And to use it as a full work meeting. And the work meeting is going to be setting our dates, goal planning for the group. Goal planning with how are we going to start to accomplish prevention work in a COVID-19 environment, and where does this group fit into that? I heard Sandra say, we've got some of this going on already, so we don't want to duplicate that necessarily. We want to work alongside that, like Rosalind mentioned. So I will, yes, I think that's the best, is let's get a survey out to you today. Let's also get latest Monday. Let's do it Monday morning, by Monday morning. And then we'll talk about the end of the month, and then we'll begin the planning. You have something to add, Rosalind?
Yeah, I was just going to add that, please feel free to let us know your feedback, right? Like I've heard people are interested in data sources, and these are, topics that we can bring to the next learning exchange. That way we can provide you with information that's very useful to you in the work that you want to achieve. And also, gaps in data. So those are two areas that I've heard today. And so I'll make note of that just for the next learning exchange, so that we're making sure we're meeting the needs of folks who are present. It isn't just for counties, right? You're welcome to invite folks to join us, anybody who's interested in, using data for prevention planning. So yeah, that was what I wanted to add to. And this is, based on your schedule, based on what works best for you. And these events are also recorded, so that if anybody isn't able to make it to the next one, we hope that you can, right? We really, because this is, made for you and by you, right? And so we hope that you can make it. It's also going to be recorded, and we will also provide accessibility features to make sure that it's inclusive as well.
Definitely. So before we leave on a Friday, so I can't say enough how excited I am you came on Friday too. Before we leave, I want to know if there are any final thoughts or any final wants, needs, or hoorays. You could put whatever you'd like before we sign off. Any final thoughts or comments?
And while we're talking about final thoughts, comments, and surveys, I'm putting a link to our evaluation for today on SurveyMonkey. We still obviously want to hear what you have to say in person, but maybe if you're not comfortable critiquing us to our faces, maybe you have some deltas for the meeting. I have put the link to the evaluation, so please fill that out as soon as possible. But also, yeah, we want to hear, what did you think of today's meeting?
Yeah, and I'll also be sending out resources for folks just to kind of supplement the work that we've been doing today in a follow-up email. That way everybody has it. I'll send out the presentation too with the different slides on data, things to consider as well. And thank you so much, everyone, for joining today, for being here on Friday, and sharing your time with us.
Thank you, Troy. You did a good job.
Thank you. I always need to hear that. So in closing, it's probably one of the better planning meetings I've been in my life. We got some information, and I think we began to share foundationally what our needs are, right? Just beginning to understand this work. So happy Friday. Look to hear from us by Monday with regards to some sort of survey link, with regards to planning link around next dates of meetings. And outside of that, you are free to go, and we will hopefully see every single one of you in our next connection. Take care, and in collaboration, I sign off.